their certificates, they'll have the opportunity to tell us where they are going, and then also to say what they would like to say, and which is always a highlight of our graduation ceremony. In addition, I want to use this opportunity to thank our medical education team for putting this together. This last year, I think our innovation skills have improved more than they have in the previous 20 years. So it's been remarkable as to how this has all come together, and it is truly a team that is there for medical education. They're helping with the greeting and helping getting people directed in the right direction. So thank you to them. A special thank you to Cindy Steinhoff and Jennifer Lee for really coordinating the events today. So with that, I would like to start with our general surgery residency program. And with us today in presenting will be Dr. Ben Jarman as the program director of the general surgery residency program. Dr. Melissa Johnson is the associate program director. And I do not believe he's with us today, but I also want to acknowledge Dr. Lee Trombetta, who is the surgical skills lab director for the general surgery residency program. Thank you.
Great. Thank you, Dr. Thompson. So Dr. Rathgaber, Dr. Shapiro, Dr. Thompson, members of the board, members of the executive committee, thank you for steadfast support and leadership through a most tumultuous year filled with challenge and plenty of opportunity. Thank you to our associate program directors, as mentioned by Dr. Thompson, Dr. Jake Peschman, Dr. Mel Johnson, and Dr. Lee Trombetta, in addition to our administrative support with Trudy Johnson, Carrie Boyle, and Melissa Hess, all doing great work throughout this past year. Thank you particularly to the families of the trainees that are here both virtually and in person. You're just for raising formidable residents, for raising formidable kids that have just done outstanding work in our short time of getting to know them over this past 5 years. These three chiefs are special on many fronts, but just in their help of helping us maintain morale this past year, providing outstanding patient care in the face of a lot of adversity, and also helping me in how to alter our residency program for the future, for better things. So for everyone in the audience, general surgery residents complete 5 years of rigorous training, and they have fairly substantial research requirements that are mandatory along their trajectory. They become kind of ingrained in the fabric of our institution. So my thanks to people that I've listed certainly falls far beyond that, with all the ancillary staff, with nursing teams, OR staff, our department faculty. The surgery residents are really engaged on just about every level of the institution, and it just takes an entire hospital system to do what we do. Dr. Lishka Havel, Dr. Nolan Rudder, Dr. Colby Seegmiller. There are three chief residents, and absolutely overwhelming to consider their contributions to our system, but also to consider their future dedication to their patients, to their healthcare systems, and also to the communities which they're going on to serve. Collectively, this team of residents has accomplished more than 4,000 surgical procedures, more than 800 endoscopies, managed hundreds of critical care and trauma scenarios, and provided surgical consultation for thousands of patients in our system. They've served on hospital committees. They've identified areas for improvement in our system and worked to improve those problems, and worked tirelessly to help guide our program. The future is indeed bright when I consider this group's talents and dedication. So I wanted to briefly introduce each of them. I'll have you each come down individually after I introduce you individually to share your words of wisdom and reflection for us. So Dr. Lishka Havel. Dr. Havel heirs from Wilhelmina, Oregon, where she grew up with neither electricity nor running water. She excelled at just about everything, and her mom reports that she rarely misbehaved, or at least rarely got caught. She's an incredible athlete, competing in both soccer and track and field throughout her collegiate years, being all-conference in both sports throughout her time, but then also being an All-American, where she was competing in the heptathlon during her senior year. She served as captain captain for both teams. And certainly those leadership skills and abilities have persisted with her as she's engaged with healthcare advocacy and education and plans to do so moving forward. She is constantly on the search to improve problems, to advocate for her patients and colleagues, and to encourage others to reach their potential. She and husband Will welcomed their son Roscoe into the world just over a year ago. It's an honor to present Dr. Dalishka Havel. Well, no. Let's hear it up on this virtual platform. Woo-hoo.
We'll take just a few moments and I'll be brief. I just wanted to say thank you. So we've already heard about the amazing way in which this healthcare system has integrated to train us as general surgery residents, and I think that's absolutely the case. And so I'd like to extend a very warm thank you to folks on all levels, from our staff in the surgery clinic to our surgery floor, nurses in the operating room, and then all the way up through our leadership that has been very receiving of our feedback, as well as has allowed us to integrate fully into this system. And then, as Dr. Shapiro and others have mentioned, absolutely could not do this without significant support. And so my family's a long ways away, but I think they're online somewhere. And so I wanted to say thank you to my parents as well as the family that I married into. My husband has been fantastic. So I always try to thank him. And my running joke is that every time I try to thank him for running around and chasing our toddler, he doesn't hear me because he's running around and chasing our toddler. I think that's what he's doing right now as well. But a big thank you to him. And then to all of those who are welcoming me into a community back in Oregon. I'm very excited to be going back home and enjoying providing for those patients and in that practice a little bit closer to home. So thank you so much. My gratitude is extensive for the training that I've received here, as well as the wonderful friendships that I have made.
Thanks, Dr. Havel. Dr. Nolan Rudder. Dr. Rudder hails from outside Lincoln, Nebraska, where he grew up in a rural environment, and he and his brother Max had kind of the run of the land there. He is an incredible musician with a focus on the piano. He's also a tremendous golfer. He was a brilliant kid growing up, known for his ability to retain every bit of information he studied, and furthermore, teach other people that very information. He knew he wanted to be a surgeon based on a mentor that he interacted with throughout high school. And along the way of his osteopathic degree at Des Moines University, he obtained a master's in anatomy, along with a side year in a podiatry program. Dr. Rudder is a terrific educator, one who can relate to any level of learner and explain things in a way that is uplifting and sustaining. This skill is even evident as he teaches those who are more senior to him, including his program director. We're excited that Dr. Rudder, his wife Emily, and 1-month-old Olive, who's here and cute today, will be returning to join us at Gunderson next year. It's an honor to present Dr. Rudder. One down.
Okay. So I guess, I was kind of thinking about what I was going to say for this, and you think, I'm graduating, but I don't really think I'm graduating. I think, we are graduating. What I mean by that is everybody who's helped me along the way. So starting 33 and a half years ago, those people back there raised me, taught me, oh, I'm emotional, taught me what it means to work hard. And I kind of carried that on through college and in the medical school. And when I got here, It was just a really amazing group of people to work with and a really awesome family. I've learned something from everybody at this hospital, and I'm really grateful for the training I got here. I think the unique thing about Gunderson and the education you get here is it's not so much about I'm the teacher, you're the learner. It's everybody's learning together, and I can definitely appreciate that as I've gone through. I still learn things from the medical students. I still learn things from the junior residents, and that's part of what has motivated me to continue being an educator and come back to this place, because it's truly unique. And I don't want to lose that. And it's just something that I think it's hard to really put it into words until you experience what Gunderson's all about. So I really, truly do appreciate everything that everybody in this room has done for me, and everybody online. Every person along the way has contributed to my education in a positive way. And you hear stories when you're a medical student about how terrible surgery residency is, and I was very nervous about what it was going to be like. When these folks were training, it was a little bit of a tougher road, and it still is. But I think Dr. Jarman has created a culture here that is just unlike anywhere else in the country. So again, just very grateful for everything, and I'm really excited to come back and work at this place. So thank you.
Dr. Colby Seegmiller. So Dr. Seegmiller grew up outside Salt Lake City, Utah. He grew up fast, being the oldest of 5 siblings, and his parents leaned on him early and frequently, often to help take care of the kids. And this was all a critical factor in his mom's successful pursuit of her dental hygienist degree. He learned the power and love of family from his parents and started his own early with his marriage to Ashley when he was 19 years old. They had 2 children, Grayson and Conlon, before medical school, and then a river came along the way during medical school. So for all of us who have experienced the rigors of medical school and residency, it is simply impressive or unbelievable to consider the dedication, balance, and energy that's required to maintain such steadfast commitment and to do so successfully. For obvious reasons, Dr. Seegmiller is our most sleep-prone resident, who's able to take advantage of any instant of downtime to catch a wink. But that does not take away anything from his abilities or his dedication. He's an incredible human being and will be missed greatly as he travels across the strait to his next destination. It's an honor to present Dr. Seegmiller.
I just want to say, it's just amazing to get to this point, and I could not have done it without Ashley, my wife. I love her very much, and she's helped me through. I'm getting emotional too, Rudder. Jeez. Through undergraduate, medical school, and now through surgical training, and I'm so grateful for her and our family. The surgery residency, it is, it's not as hard as it was when these guys went through, but it's definitely still really hard, and there's a lot of hours here, and this is basically, kids have always said this is Dad's second home, but it's been an amazing place to train, to learn, to become what I want to be as a general surgeon, and I'm so grateful for all the attendings that have taken their time, have had patience with me, patience for me, to take care of their patients, and so grateful for the team at Gunderson, all the nurses, all the staff, just in the ORs and the ICU on all the floors, working together to take care of our patients. I'm so grateful for that because I've learned so much over these last 5 years. And I just want to say thank you to everybody.
Thank you. And full disclosure, surgery residency isn't harder now than it was in the past, or harder in the past than it was now, but the responsibilities are a little different. And anybody who is graduating from this program was certainly capable of graduating from programs in the past as well. So it is a rigorous training pattern. The responsibilities are different now, requirements are different now, but phenomenal that our 3 graduates have gotten through the program and done exceedingly well. So I think there'll be a pause now for the next 20 minutes until 9:30 when the MIS fellowship will be presenting Dr. Desiker. So thank you for your attention at this point, and we'll be on pause for the live stream.